Okay, Morgan, everyone once in a while needs to talk about a few of those issues that may be a little embarrassing to talk about, and that's why, 8 West is a great forum to discuss these issues that you discuss with one of your best friends.
Absolutely. Well, what we're talking about today affects women of all ages and women more than men. We're talking about bladder problems, urinary incontinence.
Dr. Christine Heisler is the chief of urogynecology at Spectrum Health. She's rejoining us. You were here, I think one of the most fascinating medical guests that we've had here to talk about this issue that really people don't talk about, but a lot of women face, the issue of incontinence. Yes. So let's talk about what exactly it is.
Urinary incontinence is just where urine leaks out of the bladder. It can be due to a lot of different reasons. Most commonly it's stress incontinence, which is where you leak with activity or exercise. It can also be urge incontinence, overactive bladder. It can have functional incontinence where you just can't get to a bathroom in time because of bladder contractions, or sometimes there's holes in the urinary tract.
Okay. Wow, so are there all the different kinds? I mean, you just mentioned a couple, but are there more? What kinds of different incontinence are there?
Well, that's most of them. There's really, you can have a combination of those types as well, so mixed incontinence occurs most commonly. So it's unusual to have just one thing that causes the problem.
Okay.
Okay, and the reason why we develop incontinence at different times in our life, are there things that we go through as just kind of part of our normal life process?
Certainly incontinence peaks when we go through menopause. So there's some changes that occur with our anatomy that put us at risk of getting incontinence. But also after things that are that change our anatomy, like with pregnancy and childbirth.
And why is that?
It can be a change of the nerves that tell the muscles what to do. It can be that things stretched out, they don't have the same tone. There can also be some irritation as the nerves regenerate after birth that predispose us to having leakage.
Okay.
So what are some, necessarily treatments, but ways to control this or ways to get help with this?
Well, the first thing I think is to feel empowered to talk to your physician or your practitioner about it, recognizing that this is a very common condition and that there are many treatments. And treatment really is dictated based on what's wrong. So as a provider who takes care of a lot of women with this condition, it's often the first step to diagnose what the actual leakage is caused by, and then to offer the treatments based on that. So, for example, when a woman has urge incontinence, there oftentimes are medications that can be used, physical therapy, sometimes even just changing when you take medications or what you eat and drink can make a big difference. Whereas stress incontinence is really a functional problem of the anatomy being not well supported. So treatment is more of a surgical base.
And when you talk about surgery, even the surgeries and those kinds of treatments aren't really overly invasive anymore because there are some great strides that have been made.
Absolutely. It could be an outpatient procedure for either urge or stress incontinence, so the recovery time is short. It can be very efficacicious over 10 to 15 years of the data that we have, so women can see good long-term results in some of these very minimally invasive procedures.
Fantastic. And for you, I know as a healthcare provider, you're probably the next step after someone's primary care or OBGYN that they would see. How important is it that you have a relationship with your doctor, that you can feel like you can discuss these kinds of almost seemingly embarrassing topics?
Well, I think it's very important, and to recognize that as physicians we're trained to handle somewhat embarrassing or problematic topics. This is a hard thing to discuss, but we've all been trained in this, and there's nothing you can ask us or talk about that we haven't experienced from another patient or perhaps even ourselves. So, to just have a voice and recognize that we can at the very least educate you and tell you what's going on and then support whatever decision you want to make.
Well, I know you have some events coming up too for that support, that education, all about urinary incontinence coming up. Tell us about those events.
Well, we're doing a seminar on October 26th. That evening, myself and Jennifer Vandevect, who's one of the physical therapists, we have tag team lectures before, very open forum to discuss a lot of bladder control problems and measures to correct them or to treat them. And then we also are going to have a booth at the Women's Expo in November. So November 11th through the 13th, I will be there as well for part of the time, a way to just get information, ask questions, and get to know our team.
Wow. It is really interesting and such an important topic. I know, I'll be 47 next month, and my friends that I'm with, we've all given birth a few times, many of us approaching menopause, and so it's an issue that we face. Morgan, look what you have to look forward to. Yay. And we should also say that for men, there are issues as well, and you are
Yes.
fully capable of treating men.
Well, no, I'm not. Actually, that's an important
Okay.
distinction. Because of being a urogynecologist, I only see women. Urologists would help men. There are some incredibly talented urologists in this community. Again, I would encourage any woman who's struggling with these problems, or men for that matter, go to your primary care doctor, bring the subject up to them, let them help make the referral to whomever is appropriate. A lot of talented physicians in this community. We're very lucky to have such a great force of medical providers. Certainly, I'm one of many, so I'm happy to see anyone who has any concerns or questions.
Fantastic. Thank you so much. A great
you.
conversation to have.
Thank you.
Stay with us. We'll be right back.
Are you West?